Alderwoman Hubbard. Chairwoman Flowers.
Here.
We have 5 present and we have a quorum.
Thank you, Mr. Clerk. Today we have before us Board Bill number 36, introduced by Alderwoman Lyda Krewson. Would you like to please come on up? If there's anyone here from the public that would like to sign up to comment pro or con, you need to sign in over to her right to be called on, okay? Thank you, Alderwoman.
Thank you, Madam Chairman and members of the committee. The board bill that is before us today is a prescription drug monitoring program. This, well, let me back up and say that we all know that heroin is an epidemic in our country and certainly also in our city. And many medical professionals believe that the gateway to heroin are the controlled substances, the prescription drugs such as OxyContin and other substances like that, which many kids or young people get started on just out of, you know, their parents' medicine chest, or you know, they're very easily accessible. So what the other issue is that they're widely available on the street, these controlled substances, or through drugstores, and often that comes from either being stolen, the drugs are stolen, or perhaps bought through some illegal means. But at any rate, because folks are able to get these prescription drugs pretty easily, then they get hooked on these and then they graduate to heroin. So in addition, some folks shop doctors and pharmacies and other dispensaries to be able to get their supply of prescription drugs. And across the country, 49 states require the dispensers to register or record who's getting those prescription drugs. And it's called a prescription drug registry or prescription drug monitoring program, so that someone who is thinking about prescribing a prescription can actually look at this registry and see whether or not this person maybe just got it 2 days ago from another pharmacy or another doctor, that kind of thing. So what this board bill does is this requires the city health department to work with the county health department and establish a prescription drug monitoring program so that that information would be available. Now, the county passed a bill that's very, very similar to this in about the 1st of March. We were going out of session then, so we didn't have time to do it. The state also has a bill before them that considers establishing a statewide registry. It's been before the state a number of times, and the state has never passed it. So the purpose for introducing this bill now is to, before the state goes out of session in 2 weeks or a week and a half, to send the message to them that not only is St. Louis County going to do a prescription drug registry, but so is St. Louis City. If the state ever did a statewide registry, well, we wouldn't need to have ours, of course, and we'd just stand back and participate in the state registry. One of the critical things about this is that if you have a registry program, well, everyone in the state or everyone who has it should use the same registry. So I talked with County Executive Stanger about this a couple of weeks ago, and he's very open to having the city health department work with the county health department. They led the way on this issue, and so it would not work for the city to have one registry and the county to have another. So that's why this bill directs the city health department to work with the county on this registry. I think that's most of the salient points here, so I would ask you to consider passing this bill out so that the city and the county work together on the same program. It's likely that the county will be using a vendor to actually implement this program, and they are getting ready to or considering putting out an RFP shortly. in order to select a vendor, because there are, several people who do this in many states across the country. So we wouldn't be actually most likely not establishing our own sort of system for doing this.
Okay. So I'm looking at the bill that you gave me last week. I see it's changed a little bit, so I'm gonna try to keep up with the sections and so forth. But, so this registry, you said that so physicians will be able to look at this registry to keep a log, and is this an app? Is this a website? What is this that they'll be able to get into?
As I understand it, it's a website. So dispensers are already reporting this to insurance companies and that sort of thing, and so this would be a program that's tied in with that, so they actually don't have to do it again, but rather that same information that they're submitting to insurance companies or whatever for these drugs would also be going into the prescription drug registry. And that is sort of one of the details that will be worked out when we actually get together, the two health departments and vendors who are going to do this, to figure out who we're actually going to use. And you'll notice in Section 4 it says that the information, except when provided to persons or agencies authorized by this chapter to receive the information, dispensation information submitted to the department is closed record and not subject to public disclosure, of course. So
like on page 3 of 10, when it's given the definition of dispenser, and it says, however, the term does not include, and I'm looking at line 2, it does not include a practitioner B. Why not a practitioner have access? Because some of us, I have a doctor that has a lot of patients, and I'm normally passed over to the practitioner, which I actually like. And I'm just wondering, why is a practitioner, though they're able to prescribe medication, not allowed the database access?
I don't think practitioners are able to write prescriptions for these kind of controlled drugs.
Is there anyone here from the health department? No? Okay. We'll have to see if we can figure that out. That may be true. Don't know. At this time, we'll go ahead and let the people from the committee ask some questions. I do have a few, but I don't want to hog all the time. So, Alderman Ortman, do you have any questions?
No, I don't. I just think this has been a long time coming, so I commend you.
Thank you.
Putting
Well,
that there.
a lot of people working on this, a lot of co-sponsors on this who want to see this happen also.
All right, sorry about that. Alderman Boyd?
I was looking for where I saw it. It's what the reporting requirement. It talked about electronic reporting.
Right.
And that could be a waiver, I guess, if someone doesn't have access to a computer or something. Is that what that's about?
I guess so. Yeah. I mean, it's something that's in the county bill, and we wanted this to mirror the county bill as much as possible.
Okay.
So.
And kind of like a follow-up question to Alderman Flowers, because I know I get prescriptions from a physician assistant who actually writes prescriptions. Maybe because I go to the VA, it could be a different system, I don't know. But they're kind of like practitioners, but they're actually called physician assistants. And then there's nurse practitioners. So I was just wondering,
Right.
does a physician, I know they write them at VA. So
I don't know the prescription drug. I don't know the answer to that. Tim, do you know the answer to that?
Well,
If that's okay.
I think the way this is drafted, the point that the chairman was asking about, that point of the bill is defining who is required to report. Okay, so it's not saying who is not required who doesn't have access to the information. These are the people who don't have to report. And my understanding is that this is drafted so that if you're in the hospital and you're getting essentially a single dose or just doses while you're there, they don't have to report it. You see, I mean, this is about people having ongoing prescriptions that they're taking home, number one. And then number two, there's a question that I don't know the answer to that Alderman Behringer was nodding her head about. I'm not sure that practitioners under the law can prescribe these categories of narcotics. Yes, there's no question that nurse practitioners, can prescribe a number of things, but I don't know. I don't know the answer to that question. I don't know if that helps.
No more questions, thank you.
Okay, Alderman Williamson.
Thank you, Madam Chair. I think it's a great bill, just like what Alderman Ortman said, it's long overdue. And I guess we do need someone or some organization or pharmacy or facility or government body to kind of monitor the way the prescriptions are being used so they're not abused. So I just want to say I want to be added as a co-sponsor. Thank you.
Alderwoman Behringer.
All right, I just want to make sure I understand this. So, first of all, this is a perfect example why a regional health department would be perfect, because clearly we need to work together as a team. But help me with this. So when we defined dispenser, are we just talking about Walgreens, CVS? Are we just talking about the doctors? I'm just trying to figure out, at what point does it get registered? Does it get registered when the doctor writes the script, or does it get registered when they fill it?
I think it gets registered when it's filled, is the way I understand this.
Okay, so
Although I suppose it is, which is why this practitioner or otherwise person who administers such a substance. So if I hand you one, in the hospital, that was a good example, which I hadn't really thought of, but so dispenser means any person who delivers one of these scheduled drugs, 2, 3, or 4, controlled substance, to a patient. If you deliver the drugs to a patient, they administer it to themselves, I guess is the...
right, so it means basically dispenser is, in a nutshell, it's anyone who makes the
fills
drugs.
a prescription.
A pharmacist. Pharmacy.
Yeah, fills a prescription, yeah.
And that's what I thought,
Yeah.
but I just,
Right.
because that is the case. You'll be in the hospital, they hand you a bunch of scripts, but you don't necessarily fill them.
Right.
Well, somewhere in the bill, I read that if you, particularly like if you're in the hospital or in outpatient care, that you can be given a dose or two while under that care. So I'm assuming, and that says that does not have to be reported.
Right.
So I'm gathering from the bill, and what I read is that it is cataloged at the pharmacy too.
Yeah, well, the pharmacy, I think, is going to be the one doing most of the reporting here. Bear in mind, the purpose of this bill, is not to prevent people who need these drugs from getting these drugs in the hospital or otherwise. But it is to keep a registry of, I got a prescription today, and tomorrow somehow I get another prescription from another pharmacy. Or maybe I go to another doctor and I get my prescription and I fill it. And so it's really to prevent me from having wide access, to abuse or the drug personally or distribute the drug. It's not to prevent anyone these are good drugs, right? So it's not to prevent anyone from getting the drugs that they need.
So then, and I understand that, so that's why I'm trying to make sure I understand that that's what this bill's going to do.
Right.
So where in here does it, and if it's in here, I missed it, because I didn't get the last section done. What is the time frame? So let's pretend you're Walgreens and a particular person monthly gets one of these filled.
Yeah, it does not designate that. What it does is provide information to doctors and pharmacists to raise a red flag. It doesn't actually prevent you from getting it filled again, but it does provide information to the folks prescribing and filling.
And the state board.
And the state board.
And the
Yes.
law enforcement, in case they have to look into a physician that's actually abusing it, giving it out
Yeah.
knowingly.
Day after day after day,
Yeah.
yeah.
Right, but but this bill's goal is to see that people don't have access continually to these drugs.
Well, not really. If you have a medical need to take one of, these drugs.
No, I didn't mean
continuous-
that they're, like we just said, they're going from doctor to doctor to doctor.
Yeah.
To get the
Collecting
same.
data.
Right, but it's not to penalize
No,
the doctors, right? So I'm just making sure, right? And when it is caught, was there anything in here for them to get help with their addiction? Okay, thank you. Like I said, I didn't get completely. All right.
You said what? Page 9.
Page 9. To help.
You know, that penalty is for someone that accesses the database.
right. If
Without
somehow
getting
you get in,
permission.
yeah. Just like there are laws that say who can get into, I don't know, license plate registry. You can't use this for some ill use. And if you do, there's a penalty. So you can't just,
No, I get that. I was just saying, once we find someone who is shopping around, that we would have something in there that would say they need to go to drug and alcohol rehabilitation or
this
something.
bill doesn't
I don't know.
actually do that. What the penalty here is that no person, it says, absent their lawful authority, shall knowingly access or disclose prescription or dispensation information maintained by the department or as its designee. And that's just really to keep the information, which will all be accumulated in one place, in one database, to keep that information private and secure, which it should be.
Oh, absolutely. So then that goes to cost. So when we're saying we're keeping it, it's in a database. So this database already exists. We're just adding another component to it.
The database exists in 49 other states. We don't have it here. And this is essentially requiring St. Louis City and County to work together to establish that database.
Okay. So you said it might be outsourced, and then we would.
Yeah, just like a third-party administrator, TPA, just like, your insurance or whatever. There are companies that are in this business.
Okay. Do we have any idea how much that would cost? Just out of curiosity.
No, Sam Page, Councilman Sam Page is the county councilman in the county,
And a
who
doctor.
also happens to be an anesthesiologist, which is handy. He could not be here today because we're meeting at 11 o'clock on a Thursday, so, but he would be very happy to come and talk to any of us about this, and he has a deep knowledge of it. But, now where was I going with that?
I was asking you about cost of the
Oh, yeah.
database.
Okay, so
where
thank
we
you.
find
Thank
how
you
much
for
it would
that.
cost.
So there will be some costs associated with this. He thinks that there also are federal grants available for the implementation of this kind of a program, and that is all part of working together with the county to figure out, well, what would this cost, and hopefully getting this expanded. He has also talked, as have a couple of folks in the mayor's office, talked with St. Charles County and other surrounding counties, and the hope is that we can all kind of get together on this, but this is one step, the city joining the county in doing this.
Yeah, that was my follow-up. Have we talked to Franklin County, Jefferson County, St. Charles, and Illinois?
Illinois has a prescription drug registry.
Excellent.
And I think right now, I don't know if they've talked to Franklin and Jefferson County. Certainly that's on the agenda to do. But, just like a lot of things, when the city and the county get to, other people are more likely to join in.
So then, do you have any idea why the state has not passed it?
Well, it's my understanding that there is a senator who is also a doctor, Stoff, I think is the correct pronunciation, who is opposed to it on some privacy issues. And I haven't spoken with him, so I'm just repeating what I've heard before. But so they, I don't know, they can't get it done. I mean, I ask myself that a lot about the state legislature. Do I have any idea why they haven't passed this or that or this or that? But anyway, they have not. And, you know, I hope this bill encourages them to get with the program.
So is this the same language that they had at the state level, just out of curiosity?
It's the same language they have at the county, and very similar to the state level, but I haven't actually done a compare on the two.
Okay.
But Sam Page, Councilman Page, has been working with the state also on this. He's really been kind of taking the lead on this, which makes a lot of sense considering he is an anesthesiologist and has a lot deeper knowledge about this than I do.
I think that's it. Good, thank you.
I think one of the exciting things, if I can just add a comment, is just the city and the county are working together on something. That's, you know, hear, hear.
Alderwoman Howard.
I know it's hard to say cost base on this. Is there any, you know, I mean,
You know, I'm not going to
because when I
guess.
asked about it, the
He
cost
thinks it
was-
won't be, Sam Page thinks that if we are able to get some federal grants for this, that it will be nominal. I
It's
don't.
not like we're inventing the wheel.
Correct.
And what's the time frame on implementation once this is passed about?
Well, the county is beginning, that, you know, they've got about a 2-month head start on us on this, so they're really beginning their implementation already. So I think when this is passed and signed, then our health department will begin, you know, working with the county health department on this, and you know, in some ways we'll be following their lead. Yeah, I don't, but it will be, you know, moving at that point. But until that happens, I mean, I suppose we could, our health department maybe could have voluntarily done it, I don't know, but I think, you know, this bill will get us moving along that path.
Is there any pressure being, I mean, I know we have a majority, or we are lacking a majority up in Jeff City of people to move them along and do a statewide thing, or is it that
You know,
we can't wait for them? I understand that. But
there are a lot of people who want this to pass, but it hasn't at this point. You know, I've talked with Washington University about this bill because, of course, they run a big medical center, and they've actually talked to SLU. I haven't personally talked with them, but and there is someone here from the College of Pharmacy today who's really just here to observe and to hear our testimony. But, you know, nobody wants these drugs to be more easily available than they should be. That's why they're controlled. So.
okay, thank you.
You know, I bet we've all had the experience, I have, of having some little minor surgery or a wisdom tooth pulled or this or that, and you go home with a bottle of 30 painkillers, and then, you know, you take 3 or 4 or 5 of them, and then you got this bottle sitting around. I should mention that I believe, is it, Brad, is it this Saturday? It was last Saturday. It was last Saturday, okay, that's right. So, you know, now there are starting to be places where you can go and deposit or, you know, turn in your excess drugs, so they're not just sitting around in your medicine cabinet for, you know, somebody to get. I mean, if mine sat around for a long time till I finally got rid of them, and I will tell you this, I didn't look at them every day to see if anybody took them. So I think that's, you know, that's where a lot of this starts. So that's probably another bill about prescribing that hopefully would,
Okay.
convenient to prescribe 30 even if you only need 6. But
I think Alderman Boyd had a follow-up question.
I do. The first one is actually a comment, because I don't know how important it is, but I was just stuck with the physician assistant piece as it related to the definition of dispenser. So state statute 334.747 does give authority to physician assistants to dispense Schedule 3, 4, or 5, and 2 when delegated by the authority to prescribe controlled substance in a supervision agreement. So I just want to bring that up. I don't know how that impacts the bill, but I did want to look that up. Can you talk more about Section 9? I'm not, it's given authority for the comptroller to establish this fund, but the fund start at zero, or we're going to deposit, how does this fund grow?
This would be if we were able to
Get a grant.
get a grant. It'd be the most likely, so that there would, there would be a place to put the grant money.
Okay, gotcha. Thank you.
Thank you. So the electronic transmission, pardon me?
Sorry.
What were you gonna say?
No, I was just following up, the comptroller has no problem with that.
I have not checked with her truthfully, but I can't imagine that she would have a problem if we got a grant. And this is just sort of a formality. If we do get a grant, you know how we have to gotta have a spot to put it in. So this just enables that if we do get a grant.
I did have some questions for the health department if they came today, but they have not. So I'm going to have to try to email them because I don't know where it is in this bill, but in the old bill, it was establishment of monitoring program by the department in coordination with St. Louis County, and it says that the St. Louis City may implement such departmental rules which in the opinion of the director are necessary to implement such program. The program shall operate so as to be consistent with the federal laws. I was going to ask what the federal laws were. I didn't, and where I can find it on the website. Then it says the rules may provide for the director to suspend the requirement of reporting a particular category of information pursuant to Section 2. So I had some questions because it said that the reporting, we will have to approve that here at the Board of Aldermen. So I'm going to have to email. Have you had a discussion with Melba? No?
I have not.
Okay.
As you remember from when we got together to talk about this, the health department had also been working on a bill. The city councilor's office had been working on a bill, but they just were not as interested in getting it done like right now as I was. That's why I wanted to introduce this. So we have a copy of the bill that the health department and the city councilor were working on, and the change in the language in this bill came from their bill.
Okay, gotcha.
Because that's the way they had wanted it written, and when we looked at it, Tim looked at it, he said, oh, well, yeah, that's actually a good way of doing it. So we adopted their language and put it in the bill. Okay. There were very few other differences in the bill, and so when we got that health department bill, which was after this was first drafted, Tim looked at that bill and we did a compare and decided that was preferable.
And you mentioned there were 49 states that's already keeping this
that have passed
data.
This legislation. I
haven't heard of any of the databases being hacked or anything like that would have leaked out any private information that you know of?
I'm not aware of anything like that.
And Tim, maybe you can answer this. I was looking at I don't know if it's still Section 6. I guess it's Section 7. And I'm just not understanding. Section 7 says pharmacists and prescribers may not required to obtain information from health department. So I'm assuming that whatever the health department collects, it's saying that this ordinance shall not be construed or interpreted to require a pharmacist or prescriber to obtain dispensation information possessed or maintained by the health department. What is that really necessarily doing? Why is that in the bill?
Well, the bill provides for the data collection, but it does not direct the doctors or the pharmacists to look at the information.
Okay, so really when they get into this log into this database, which I'm assuming
If they want to, if they decide they should.
Okay, so they can only log into this database to find particular information about a patient.
Or yes.
Right, but they can't look at it accumulative of everything. Is that what you're saying? So because it's saying the health department is going to be able to categorize this and keep this for reporting purposes. So I'm trying to understand that clause, that section.
Tim, you want to say it better than I did?
No, I think what it's saying is it's not putting a requirement on doctors or pharmacists to do anything.
To follow up, to look into it.
Pharmacists are required to report, but we're not telling them how to practice pharmacy or how to practice
Right.
medicine. Although presumably, if there's an abuse, the state will come in and start
Right.
telling them how to practice medicine and how to
Gotcha.
practice,
Right.
pharmacy.
Okay.
Does that make sense?
Makes a little sense. I was just wondering, to me, it just sounded like it was a protection for the health department in the data they were collecting, that for some reason they can't have access to that. But that's not.
No.
I just didn't.
It's really that now, if a doctor or pharmacy, if they suspect, well, they don't have any place in Missouri to go to look, to check. I happen to know from talking to another doctor about this that if BJC has some kind of an internal system that would allow somebody to check, but there are many, many other doctors or places that you could go. So you go to BJC one day and St. Mary's the next day,
Right,
and
right.
and so it's right now, if a doctor, let's say, does suspect, or a pharmacy does suspect that maybe this person, maybe there's too many prescription drugs going to this person, they don't have any place to go look. This registry will give them the place. If they have the thought in their mind, maybe I should check on that, this registry will give them that information.
And it'll
But
show
it
them
won't
how-
require them to go every time they prescribe it. We're not
Gotcha.
putting an additional burden on them. We're giving them information, collecting information, and giving them information which would be available
Gotcha.
to them.
They don't have to check every time they prescribe. They
Right.
give the prescription. It's just that they'll have access
Right.
to it. Okay. All right. Are there any more questions from any other committee members? Okay. Would you like to close?
Love to. I
Anything?
appreciate your support for Board Bill 36.
Okay, what did I do with the original bill? All right, so I'm on it. Okay. So anyone have any recommendations?
I recommend that we pass Board Bill 36.
Second.
Mr. Clerk, please call the roll.
Alderman Ortman,
Aye.
Alderman Boyd,
Aye.
Alderman Williamson,
Aye.
Alderman Behringer. Aye. Alderwoman Howard,
Aye.
Chairwoman Flowers.
Aye.
We have 6 ayes and 0 noes.
Thank you,
Thank you.
Alderwoman.
Appreciate it. Thanks, you all.
I move we adjourn.
And I move that we adjourn.
Second.